As an atlas orthogonal chiropractor who uses a specific method to correct this atlas, I get asked often, how does the instrument work? Because the instrument, most patients don't even feel the instrument. So the easiest way to explain it is we measure this bone from the side, from the top, and from the front. So we can measure exactly how it's tilted this way, we can measure how it's tilted this way, and this way. So we have a three-dimensional picture of how that is crooked. So if it is tilted, twisted, and bent, we can figure out the mathematical formula to move that bone back in the right position. And we use an instrument to do this. This changes the X dimension up and down this way. This Y-axis rotation changes a certain number of degrees this way. And then the Z changes a certain number of degrees this way. So we can figure out anybody's kink, plug in the formula to correct it with the instrument. That instrument actually comes in contact with the skin above the atlas, right at the base of the skull, while the patient's head is on a pillow, and it's a very light force. One of the issues with the instrument is it looks scary. It looks a little scary to people. So what I like to do is get over that fear, and what I want to do is show that the instrument itself will not even break an egg. So what I've done is I put the stylus that would come in contact with the skin on the patient down tight against an egg, so you can't roll that egg around, and then I'm going to step on the button and it will put a percussive force into that egg, and it does not break the egg. But if I crack that egg, it's a fresh egg. Because of the percussion, we're able to correct with a very light force that the patient barely feels.
Dr. Harding makes you feel pretty comfortable, and the staff too. They're to the X-rays, clear down to getting the procedure, and it is painless.
It's very easy, no pain, no discomfort, nothing.
It's also the percussion force that is used. There's actually a cylinder up in this head that comes down and makes contact with this stylus, and then the stylus itself moves the vertebra. So here's a good example of it. If we were to use this ball and pretend like this is the head of the instrument, when this ball drops down and makes contact with the middle balls, they don't move much, but the ball on the end moves. And that's how that works. Another good example of how the percussion instrument works is a croquet mallet. So if you were to put your foot on a croquet ball and have somebody else's ball next to it, if you hit the ball that you have your foot on, it stays put and the other ball will roll away. And that's exactly how the instrument works. That's an example of a percussion instrument.
To the point where you're almost wondering, is this really going to work, because you don't really feel a whole lot during the procedure.